Hi, my name is Josh Neumiller. I'm a pharmacist and diabetes care and education specialist. I work as a professor of pharmacotherapy at Washington State University in Spokane, Washington. I think it would be nice to take a step back and think about some of the general pros and cons of using GLP-1 receptor agonists. Certainly pros of GLP-1 receptor agonists, they have really great glycemic efficacy. Also, we can have the potential benefit of weight loss with these agents, with some of these actually having formal indications for weight loss. And low hypoglycemia risk, I think, is a benefit for a lot of individuals, at least when used as monotherapy or in combination with metformin. We still have to be cautious, particularly in people with chronic kidney disease who are on background insulin and or insulin secretagogue medications. We also have to consider potential cons and things to keep in mind to keep people safe when using these medications. Certainly access can be a barrier to use. Also keeping in mind common side effects like GI intolerance, nausea, vomiting, and diarrhea. And there are, of course, more rare and serious safety concerns. But with regard to dosing of GLP-1 receptor agonists in chronic kidney disease, it's actually an advantage of this medication class. We know the newer guidelines state that we should use SGLT2 inhibitors in individuals with a EGFR of 20 or greater. With GLP-1 receptor agonists, particularly those with expanded cardiovascular indications, dulaglutide, liraglutide, and semaglutide, there aren't any specific dose adjustments that are required with these medications, but we can use these agents down to very low EGFR. And in contrast to SGLT2 inhibitors, where their glycemic lowering efficacy begins to diminish as EGFR declines, glucose lowering potential appears to be sustained in individuals at lower GFRs with GLP-1 receptor agonists. So coming back to some of our potential side effects and safety considerations with these agents, there are a variety of risk mitigation strategies that are particularly emphasized in people with chronic kidney disease. We know the dose-limiting side effect with GLP-1 receptor agonists is GI related. So really making sure we're starting at the lowest dose, titrating slowly and judiciously. And I mentioned earlier, these have a low hypoglycemia risk, but we have to be cautious due to the potential for additive risk of hypoglycemia when these are added on to background agents that have hypoglycemia risk, such as secretagogues and insulin, especially given how potent these are in terms of glucose lowering. So really a good idea to look at those background glucose lowering agents and often proactively hold or decrease the dose of these agents when starting a GLP-1 receptor agonist to mitigate risk of treatment emergent hypoglycemia.